I'm Dr. Shikhar Srivastava from Sri Lakshmi Narayan Institute of Medical Sciences, Pondicherry. I'm a second year PG resident, and today I'm presenting ultrasonological evaluation of major salivary gland lesions. Introduction. The salivary glands can be divided into major and minor salivary glands. The major consists of large paired ones like parotid, submandibular, and sublingual salivary glands. The MSG lesions are quite common in day-to-day practice. Clinical examination alone doesn't provide correct diagnosis. High-resolution ultrasonography plays a significant and crucial role in the diagnosis and management of these lesions, and it is widely accepted as the first imaging method for assessment of a major salivary gland. The high-resolution ultrasound is helpful in characterizing and diagnosis of infective inflammatory conditions of salivary glands as well as salivary gland tumors. It is also widely used as a guidance for interventional procedures such as aspiration, drainage of abscess, and for FNAC or biopsies. Aims and objectives: to demonstrate the ultrasonological imaging spectrum of major salivary gland lesions, to demonstrate utility of high resolution ultrasonography in characterizing the major salivary gland pathologies, and ultrasonological and pathological correlation in case of major salivary gland tumors. The research methodology. This was a prospective study conducted in our institute for a period of 1 year from October 24 to September 25. 35 cases were included in this study. The inclusion criteria included males and females of all age groups who presented with symptoms related to the major salivary gland pathology like pain, swelling, etc. were included. Exclusion criteria: patients presenting with minor salivary gland pathologies, patients who did not undergo FNAC or biopsy for suspected salivary gland tumors. The major salivary glands were thoroughly scanned using high-frequency linear transducer probe. Ultrasound machine used was Mindray, and patient was made to lie in supine position with neck fully exposed and hyperextended and head turned towards the side opposite of the examined gland. Size, shape, ecotexture, extent of lesion, any calcification, cystic areas, distribution of blood supply in the lesion by the color Doppler was noted, and analysis of the imaging findings was done. An ultrasound pathological correlation in suspected neoplastic etiology was performed. Observation and results. The most common age group where we saw the lesions was between 31 to 50 years, that is 51% of our cases. Most commonly was seen in male, 54% of the cases, and the most common gland involved was parotid gland on 29 cases, and second we have submandibular gland. On ultrasonography diagnosis, most commonly acute parotitis was seen in 34% cases, then pleomorphic adenoma in 9 cases, and malignant neoplasm and Warthin tumor 2 cases were seen. Coming to ultrasonography findings, the ecotexture was homogeneous in 8 cases out of 11 benign neoplasm, and it was heterogeneous in 3 cases, and it was heterogeneous in both of the malignant neoplasms. The margin was well defined in all cases of benign neoplasm and indistinct in malignant neoplasm. The shape was round to oval in benign neoplasms and irregular in malignant neoplasms. An acoustic enhancement, most common pleomorphic adenoma. Calcification was seen in malignant neoplasm, 1 case, and Doppler in benign peripheral color flow was seen, and in malignant central color flow was seen. So we had 11 benign neoplasm, and out of 11 histopath was done. 2 malignant neoplasms and 2 histopath was confirmed, and we confirmed benign lymphothelial epithelial lesion in 1 case. Coming to the cases, here we can see the parotid gland appear enlarged and heterogeneous with multiple round hypoechoic lesions and showed increased vascularity on color Doppler, suggestive of acute parotitis. Left parotid gland appeared heterogeneous, and an ill-defined heterogeneous collection measuring around 15 cc was noted in the left parotid gland with surrounding inflammatory changes, internal echoes, and debris noted within, which was suggestive of a parotid abscess. Next case, the left submandibular gland appeared diffusely heterogeneous in ecotexture. The left submandibular duct was dilated with 2 calculi seen within it. The features were suggestive of left submandibular ciliolithiasis with chronic silidinitis. Next case, a cyst measuring 3 into 2.1 into 2 cm was noted in the right parotid region with free floating internal echoes. These features are suggestive of benign lymphoepithelial cyst. Next, a well-defined solid hypoechoic mass lesion with mildly lobulated borders measuring approximately 2.1 into 2.2 into 2.4 centimeters noted in the right superficial lobe of parotid gland. Mild peripheral vascularity was noted on the color Doppler. The features were suggestive of pleomorphic adenoma. A well-defined heterogeneous predominantly hypoechoic lesion with internal anechoic cystic areas were noted arising from the left parotid. The features were suggestive of a Warthin's tumor. Next, an irregular heterogeneous lesion predominantly hypoechoic measuring 3.5 into 3.4 cm noted in the left parotid showing internal vascularity on color Doppler. Multiple echogenic foci were noted within which are suggestive of calcification. Deeper extent of the lesion could not be visualized. The features are suggestive of a malignant tumor. On histopathology correlation, adenoid cystic carcinoma of parotid was detected. Discussion. Our study are correlating with many other studies which show that most common age group is between 31 to 50 years. The most common parotid gland in most of the studies came out to be parotid gland, which is again seen in our study, and the most common tumor was pleomorphic adenoma in most of the cases. In our study we found 61% cases. Ultrasound and histopathological correlation of tumor, benign and malignant on ultrasound correlation. In our case we got 91% and 100%, and it is broadly correlating with rest of the research available on this topic. Conclusion. The high resolution ultrasonography is an important and often first imaging modality for evaluation of the major salivary glands. It enables precise localization, measurement, assessment of structure of lesions. It may be first imaging method need to formulate final diagnosis, or it may guide fine needle aspiration or biopsy. It also helps delineating nature of tumor. It is economical, widely available and radiation free. Hence it forms the backbone of the imaging of major salivary glands. These are my references. Thank you.